My name is Elizabeth Stellpflug, and this is the analysis of the community of South Brooksville. I will present a historical overview, analysis of the community in regard to structure, population, health-related resources, environment, and government and public policy. Community needs and problems will be identified and prioritized. Brooksville, which has been the county seat of Hernando County for more than 100 years, was originally known as the community of Melendez and was settled around 1845. Fort DeSoto, a military fort established around 1840 to offer protection to settlers from Native American Indians, was located to the northeast of present-day Brooksville. Fort DeSoto also functioned as a trading post and was a regular stop on the Concord stagecoach line that ran from Palatka to Tampa. The fort was built on a heavy bed of limestone, making it difficult to obtain water. Therefore, the population shifted south to Pierceville, which was approximately 3 miles away. Brooksville was established in 1856 from the consolidation of Melendez and Pierceville. Brooksville was incorporated on October 13, 1880. There is a long history of successful planters, growers, and cattlemen in and around Brooksville. Its southern background is reflected in its name, honoring South Carolina Congressman Preston Brooks, who is best known for hitting abolitionist Senator Charles Sumner on the head with his cane after Sumner gave an anti-slavery speech. Brooksville has a long history of slavery, lynching, segregation, discrimination, and racism that did not begin to change until the 1960s when Spring Hill began to be developed. Today, historical tours will take you down some of the streets that still have the Augusta bricks that were laid by slaves. Brooksville is working hard to revive their downtown and attract more visitors and became a Florida Main Street community in 2016. The housing available in South Brooksville varies greatly. Apartments, mobile homes, historical, and new-built homes make up the majority of housing options. Many of the apartments are income-based and provide subsidized rent. There is Section 8 housing available. There are multiple homeless shelters located in Brooksville as well. Low-income housing needs are not currently being met because of the high demand of affordable housing and comparatively low supply. The waiting list for Section 8 housing has been closed, and those that made it on the waiting list may have to wait years before housing becomes available. The Hernando County Housing Authority does provide rental assistance vouchers to homeless veterans in conjunction with James A. Haley VA Center, requiring travel to Tampa to apply for and receive vouchers. Compared to similar nearby communities, Brooksville has less access to affordable housing. There are several churches in and around South Brooksville. Many offer community outreach programs that include food banks, transportation assistance, and resource referral for families in need. Educational needs for South Brooksville are served by the public schools, Brooksville Elementary, Parrott Middle School, and Hernando High School, as well as 2 Christian private schools. You can find a branch of Pasco Hernando State College, adult literacy programs, and several technical schools within Brooksville. The main branch of the Hernando County Library is located in Brooksville. While relatively small, traditional services of book lending and computer usage are offered in addition to community programs that vary, such as sign language courses, health insurance counseling, and a computer and technology class. There are 3 parks and a community center offering numerous opportunities for activities such as softball, volleyball, disc golf, tennis, basketball, walking and jogging paths, multiple playgrounds, meeting rooms, and a kitchen facility. Brooksville is comparable to other similar nearby communities in the structural features it offers. Approximately 29% of the population in South Brooksville is greater than 65 years old. This is similar throughout the county, however, significantly higher than the state. According to the Healthy People 2020, aging adults experience a greater risk of developing chronic disease. Chronic conditions such as heart disease, cancer, chronic lung disease, stroke, diabetes, and Alzheimer's can lower the quality of life and contribute to the leading causes for death among these individuals. Approximately 84% of the population is white. This finding is slightly less than the county, but more than the state. Aside from the racially based social problems that can arise from inequality, the National Center for Biotechnology Information reports that racial and ethnic minorities face difficulty in regards to access to medical care, and that when they receive care, it may not be equivalent to other groups. Approximately 7.8% are unemployed, which is higher than the state and the county, and approximately 31% live below the poverty level, which is slightly more than the county, but significantly more than the state. In the research article published by Valavo in 2016, a study done to determine the association of unemployment and poverty on deterioration in health, the results support a causal link. With 7.3% of the population holding a master's degree or higher in South Brooksville, this is slightly less than the state average. According to the Center on Society and Health, Americans with less education have poorer health and shorter lives. Education proves importance not only for higher wages and economic productivity, but also saving lives and decreasing healthcare costs. The top 10 leading causes of death for Hernando County mirror that of the state. However, the order of prevalence is not the same. For example, respiratory disease is third leading cause for Hernando and fourth for Florida. The top 5 causes of death for Hernando County are heart disease, cancer, respiratory disease, stroke, and unintentional injury. Due to the fact that white residents make up the majority of Hernando's population, they dictate the overall leading causes of death. This fact would require further investigation for the minority population to ensure health care needs are identified and met. In regard to access to health care, South Brooksville and the surrounding community offer many options. Bayfront Health Brooksville is located in South Brooksville. Bayfront Health Spring Hill, Oak Hill Hospital, and Springbrook Psych Hospital are also nearby. All of these hospitals are for-profit and accept many different insurers and accept financial agreements for the uninsured. The health department in Brooksville offers low-cost clinics, immunizations, WIC, nutritional services, reproductive health and family planning, STD screening and treatment, among other services. Community members have verbalized difficulty obtaining appointments with the health department. There is a free clinic in Spring Hill based on income, and appointments can be months to obtain, making access a concern. There are several nursing homes, long and short-term rehab centers, assisted and independent living centers in and around Brooksville. While these facilities do accept various insurance, ability to pay must be proven prior to admission in comparison to the acute care centers, again making access a concern. Multiple dental clinics exist in and around Brooksville, though offices that accept Medicaid are lacking. The acceptability of healthcare resources available are widely accepted among the population, with the exception to the hospitals. Community members have verbalized concern with quality and affordability of the 3 hospitals within the county. A low-cost clinic offered by the health department and free clinic in Spring Hill are the only affordable option for the uninsured and low-income households. All other healthcare providers accept various insurance plans and may offer financial agreements to those who are uninsured, though it is on a case-by-case basis depending on the office. 2014, the Tampa Bay Business Journal published a research study by the National Nurses United that showed 2 of the top most expensive hospitals in the country were located in Brooksville, Bayfront Health Brooksville and Oak Hill Hospital, charging over $1,000 for each $100 in cost. According to Lewis, the higher cost of healthcare cannot be sustained and will result in a reduction in service and access for those who cannot afford it. Using Healthy People 2020, 3 specific community objectives applicable to the health of South Brooksville are older adults, social determinants of health, heart disease, and stroke. According to the CDC, chronic illnesses and disabilities are more prevalent in older people, such as heart disease, diabetes, dementia, stroke, arthritis, and cancer. This is of concern for South Brooksville due to the larger population of older adults. These diseases are common causes for hospitalization. The most common and costly chronic diseases are among the most preventable. The Patient Protection and Affordable Care Act of 2010 offers provisions for older adults that include cancer screenings and immunizations. Unfortunately, it's found that older adults underutilize these services. According to Galea, a study in the American Journal of Public Health meta-analysis found that over 50 studies of social factors such as education, racial segregation, social supports, and poverty accounted for over 30% of the deaths in the United States yearly. With the population of South Brooksville being vulnerable in regard to social determinants of health in the areas of economic stability, neighborhood and physical environment, education, food, community and social context, and healthcare system, this is an area of major concern for this community. There is growth in the recognition that social, economic, and environmental factors greatly impact a person's opportunities and barriers to engage in healthy behaviors. Ranked first and fourth respectively as the leading causes of death in Hernando County, as previously mentioned, the most common and costly chronic diseases are among the most preventable. In 2006 study, Makiosik found that increasing the use of preventative services such as tobacco cessation screening, alcohol abuse screening, and aspirin use to 90% of the recommended level, almost $4 billion could be saved annually in medical costs. Creating a shift toward preventative health will not only save money, but most importantly, save and improve lives. Environmental resources are adequate with regard to water supply, sewage disposal, solid and hazardous waste disposal, and the air quality index is rated as good. Vector control is at times inadequate, especially during rainy season. Mosquito populations boom due to an increase in standing water. There is a police department and fire station designated for inside the city limits. Outliers are served by the Hernando County Fire Rescue and Hernando County Sheriff's Office. There is talk among community in relation to the trustworthiness of the Brooksville Police Department and Brooksville Fire Department. Inequality and fund usage has been in question more recently. Roadways are adequate for traffic needs. However, due to rural nature of South Brooksville, many streets do not have lights or poor lighting. During times of heavy rain, roadways tend to flood. The sidewalk project was started in downtown Brooksville to bring the sidewalks up to ADA standards. There are many streets and roadways that do not have sidewalks. Parks and recreations, as previously mentioned, there are several parks and a community center, walking trails throughout Brooksville. The City Council is made up of 5 members and hold meetings which are open to the public and are broadcasted live and throughout the week via Bright House Network. Meeting agendas are posted online prior to the scheduled meetings, as well as the minutes from each previous meeting. City Council members are available via email, telephone, and Facebook. Funding is allocated for general government, public safety, physical environment, transportation, culture and recreation, debt services, and reserves. Approximately 55% of the budget is allocated for reserves. This can be viewed as either good or bad. Many side with having enough reserves to sustain normal functioning costs for approximately 3 months, and will justify even more if a special project is being planned. Having monies in reserves will also benefit the city in case of emergencies or disaster. Others argue that taxes could be lowered if the amount kept in reserves are lowered. The top 6 overall community needs and problems are in order by priority. Poverty. South Brooksville rates significantly higher than the state in regard to those living in poverty, and is the root cause for many other community problems. Number 2, racial conflict. Having 84% of the population being white and a strong history of racism and segregation, white supremacy remains active in Brooksville today. Number 3, housing. Insufficient low-income housing. Needs outnumber availability to an extent that wait lists have been closed, leaving many without assistance in affordable housing. Homeless veterans must travel to Tampa to apply for and receive housing vouchers. Homeless shelters have few spots available with a short window of intake hours. Many are turned away due to capacity or inability to meet the criteria of being drug or alcohol free. 4, hunger. 31% of the population is below the poverty line and 7.8% are unemployed. The limited availability of food banks are unable to keep up with the needs of the community, often having to turn away hungry families. Number 5, roadways. Lack of sidewalks along certain roadways, poor lighting, and roadway flooding in low-lying areas create safety and transportation issues for many who are already vulnerable. Number 6, transportation. The high cost associated with owning a private vehicle, many are reliant on public transportation to go to work, doctor's appointments, and grocery shopping. Bus routes and times are limited and only run from Monday through Friday. This is a conclusion of the analysis of South Brooksville.